All right, so our next speaker, as Dr. Smith mentioned, is Lindsay Post, who is going to talk about other strategies to manage pain, particularly in the chronic setting, which I think may be meaningful to many people in this room. So Lindsay Post, BSN, RN, CEN, TCRN, that's a lot of letters. I'm jealous. She has been a nurse for 12 years. 8 of those years were in the emergency department at Stanford as a bedside nurse and as a charge nurse specializing in adult emergency and trauma care. She's now a nurse coordinator for the palliative care team at Stanford Healthcare. And given her diverse experiences as a nurse, she's perfectly positioned to talk about insights and strategies to manage pain other than pain medication. So thank you so much for being here with us.
Okay, so I'm going to talk to you about the non-medication pain management plan. It is a way to treat pain to supplement your pain, either with or without taking medications. It can be used for acute or chronic pain. And listed here are the methods that we're going to talk about today. The primary theme with a lot of these approaches is that stress relief equals pain relief. So we're going to talk a lot about how to reduce stress overall. And think about these approaches as a way to make your other treatments work even better. Mindfulness. The mind has a powerful influence over the way that you experience pain. Pain causes your body to be on high alert or in stress mode. So mindfulness can really help calm your nervous system and therefore calm your pain response. Through mindfulness, you can create awareness through thoughtful exercises to be present within your body. It helps redirect negative thoughts and focus on small positive actions. When done regularly, mindfulness can help reduce pain intensity and can help improve activity overall, especially with limitations due to pain. Our clinic does recommend this book. I brought a copy. I was going to show it to you, but the cover looks just like this. Oh, I want to go back. Sorry. One easy way you can do anywhere that you are is the 5 things to be mindful. So you can focus on 5 things that you can see that are around you, 4 things that you can physically touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So really using all of your senses to be present in your body. Meditation is another mindfulness practice that can control your attention and bring your awareness to the present moment. It focuses on your breathing, often using diaphragmatic breathing, which is that taking a really controlled, deep breath, getting all the way down into your belly. Guided imagery is a form of meditation. You can use audible recordings that really guide you through a scenario to help calm. There's good evidence for its effectiveness in improving surgical outcomes and recovery, relaxation, reducing anxiety, pain, cancer and cancer treatment-related symptoms, sleep, and addiction. Just like all of the things I'm talking about today, it works best to reduce pain if you do it regularly over time. And even if you can take short breaks within your day to take a mindful moment, it's going to be helpful. In some cases, meeting with a pain psychologist or therapist can be helpful. Examples are cognitive behavioral therapy, and there is a difference between CBT for pain and for depression. So you do want to find a therapist that focuses on the CBT for pain specifically. It can address the connection between your mood and pain, between your thoughts, emotions, and pain, because we do know that thoughts and emotions really can have a physical pain within your body. Goals of treatment are to reduce pain and psychological distress, reduce negative thinking and improve positive ways of thinking, and improve quality of life. It's been shown that group treatment CBT plans can also be helpful, that patients can really rely and hear the experiences of peers, and can also help with people who maybe are isolated. Art, music, and writing therapy is a way of using, again, your senses and creativity to help reduce pain. It's a way to help distract from the pain as well. Listening to music that you enjoy has been shown to release chemicals in the brain that really cause pleasure and well-being. Using art and writing is another way to reduce pain and pain thoughts by distraction. And different art methods, even using mandala, getting out in nature is another way to help reduce pain. So you can create mandalas with found items. I've personally done this one and it's actually kind of fun. Acupuncture and cupping. They are Chinese medicine practices that help balance yin and yang. It is using tiny needles that are applied to areas of pain and can help relax the muscles and promote blood flow to tissues. Risks are very low, but can include minor bleeding at the site or bruising. Some people can experience dizziness that usually lasts a short period of time. There are many offices that do offer acupuncture. Some are self-pay, some do take insurances. So you want to check with the office and also check with your insurance plan if it covers acupuncture. Cupping is another method that's done in acupuncture offices. It's done by heating up these cups that you see in the photo, and it helps reduce inflammation and kind of bring blood to the surface, causing relaxation and reducing pain. Acupressure is also done, it's like acupuncture, done in the same areas of pain, but it's used with pressure rather than needles for people who really don't like needles. And it can be done with fingertips, elbows, palms of the hand, and usually in circular motions for about 60 to 90 seconds in each area. Yoga and exercise. Again, if done regularly, it really can help with movement and sleep. Regular activity can help promote better mood, pain prevention, and like I just said, better sleep. Set up realistic expectations. So you want to start where you are. If you try to do too much or too little, it can cause pain. But small differences can add up over time. I do want to mention, to kind of help add to your exercise abilities, you want to pre-medicate if you're taking pain medications, even if it's just Tylenol or ibuprofen. If you do medicate about 30 minutes to an hour before you do your exercises, you may get better results. As you do exercises and get stronger, you can prevent future pain as well. And you always want to make it fun. So if you have a workout buddy or a walking buddy, doing something that you really enjoy will help you stick with it. Yoga is a series of poses that helps with flexibility, balance, and helps with strength to reduce pain. Restorative yoga specifically is a yoga practice that uses very slow and gentle poses. And with all yoga, you can always modify your poses to be easier or harder if you'd like. And if kind of getting down on the ground and doing poses is hard for you, there's always chair yoga as well. There are a lot of apps out there for yoga that are paid or free. Down dog yoga is a really good one. And then even just YouTube has thousands of videos that you can do. And then through Stanford, they have a Yoga X program that has free online yoga classes through Zoom, I believe it is. And then the Osher Center for Integrative Health also has free yoga classes through their website. Physical therapy can be used to build strength, improve mobility, and reduce pain. You'll work with a trained physical therapist, and there are many benefits, as you see on the screen, to working with a provider. Managing pain, physical resiliency, recovering from injuries as well. Massage, I'm sure most of us are familiar with massage, but it is a way involving pressure on the muscles to reduce tightness and reduce pain. It can be done by a massage therapist. There is also massage chairs. There's mats that you can place in a chair or lay on the ground. And then you can have a partner or a friend also be trained in proper techniques. And again, similar to acupuncture, sometimes insurance will cover massage. So check with providers and with your insurance companies to see if that's covered. Sleep management. As I said before, stress relief equals pain relief. And if you're able to have a good sleep management schedule, it really will be helpful in reducing pain. Without enough sleep, your body becomes stressed, which can make your nervous system more susceptible to pain. And getting enough sleep can improve your mood and lower inflammation in your body as well. When you get enough sleep, you also have enough energy through the next day, and that'll allow you to do the things that you enjoy and be able to do the exercises that will help manage your pain. Other benefits are you'll get sick less often, it helps to maintain a healthy weight, and it also helps with improving your memory. These are a lot of things we do. We teach our patients in the palliative clinic are really ways, if you're struggling with insomnia or struggling with sleep, some ways to improve your sleep are going to bed and waking up at the same time every day. So even on the weekends, find a good time that works for you to go to bed. Try to go at the same time every night and wake up in the morning, same thing. Start a calming routine before you go to bed. That really is a good time to, if you want to try some of these guided imagery or meditation, try those before bed and really relax your mind. And if you happen to wake up in the middle of the night, you can repeat those and try again. Another method for going back to sleep or trying to get to sleep is thinking of a word. Any word you want, say apple, and you think of all the word associations you can think of with A. And then when you run out of words, move on to P and just go through everything that you can think of with P. And as your brain focuses on other things, it really helps you relax. You want to dim your lights, make your room as dark and quiet as possible. So even covering up clocks, covering up charging, all our chargers have those little lights that peek through. If you can cover up those lights and make your room as dark as possible. And if it's not possible to make it really dark and quiet, you can always use a face mask or earplugs. Things to avoid before going to bed. If you can, put your devices, your phones, your iPads, put them away like an hour or two before bedtime. That also really helps your mind start to relax. You want to avoid large meals before bed, and try to separate your dinner time by a couple hours before it's time to go to bed. Having a full stomach and having your belly really full can keep you awake. Avoiding nicotine and caffeine close to bed. Alcohol, even though it makes you feel sleepy, it really is disruptive to your overall sleep through the night. And avoid naps throughout the day, or if you need a nap, really try to take it earlier in the afternoon so you have enough of a wake window before you go to sleep at night. Cannabis is a common question that does come up with patients. I know Grant mentioned it briefly. There is conclusive data that shows cannabis can help with chronic pain. The data is inconclusive for other pains or cancer-related pain. However, we have had patients who try cannabis for pain who have really good experiences, and it has helped. So cannabis does come in multiple forms. It can come in tinctures, gummies, baked goods, lollipops, all kinds of things. And some doctors are more comfortable talking about cannabis. Some doctors are more knowledgeable than others. So if you are interested, you really do want to find somebody who's knowledgeable about cannabis and its effects. You can also go to a really good reputable, what's the word I'm looking for? Dispensary, thank you. Usually these dispensaries are well lit, they're very clean, and a lot of times they have what are called bud tenders, who are very knowledgeable on all the products that they have and their effects. It's really important, if you do decide to try cannabis, start slow, start with a low dose, see how it affects your body. Some people really take to it and other people don't like it at all. So the smaller the dose, you can always increase and add more to it. One tip is if you do try gummies or oral intake of cannabis, keep in mind it can take a while for your body to metabolize it and kick in. So like Grant was talking about the kind of stacking effects of opioids or other medications, the same can be true with cannabis. So if you do take a dose, really wait a good 45 minutes to an hour before to notice if it reacts with your body before you take anything further. To note, cannabis is legal in California. You do not need a doctor's note if you want to try it. Spiritual care is another aspect in managing pain. It applies to people who do have a spiritual practice and even those who do not have a faith that they follow. Spiritual care practitioners can help address existential pain. And existential pain is the suffering that's kind of settles in your body when you wrestle with questions like, why did this happen to me? And what is God's plan for this? They can really help you explore those ideas. They can also help offer active listening. They can offer prayers and blessings if that is something that you're interested in. And through palliative care, we do have spiritual care team members as well. Integrative medicine practices are often a team of providers that work together. They combine treatments of conventional medical practices as well as complementary therapies that we've talked about. They can include heating and icing combinations, massage, acupuncture, tai chi, hypnotherapy, nutrition, and psychotherapy, just to name a few. Institutions like Stanford, Sutter, UCSF all have integrative medicine practices, but you can also, if you do a Google search, there's a lot of private practices in the Bay Area as well. So our palliative care team, what is palliative care? Some of you may know, some of you may not. It really is a specialized healthcare that helps people living with serious illnesses. This type of care focuses on providing relief from the symptoms and stress of illnesses. The goal is to improve quality of life, and we really do work with the patient and the family. We look holistically at you and your family together. Palliative care through Stanford offers inpatient and outpatient appointments. We help to provide an essential layer of support in addition to your primary healthcare team. And it does require a referral. You can get one from your primary care doctor, your primary specialists, like your cardiologists, your oncologists, and even inpatient teams or through the emergency department can provide referrals. And this is pictures of a lot of our inpatient and outpatient team. So in conclusion, just remember that stress relief equals pain relief. So the more that you can do to relax your nervous system really will help reduce your pain. Key takeaways that we have discussed are that you can find pain relief through non-medication strategies. It can help ease pain, depression, anxiety, stress. It can help strengthen spiritual connection, improve energy and strength, help connect the mind and the body, and help overall improve quality of life. Keep in mind that these treatments will not work overnight. Like taking a daily medication, you need to really do them every day and the benefits will build over time. And just remember, be gentle with yourself. Nothing's easy. So you, again, like starting exercise, you just start where you are and do what you can. These are some resources that we've talked about that are available to you. Down dog meditation, down dog yoga, Calm. YouTube, again, has tons of resources. Insight Timer and Headspace are both apps. I've also personally used those that are very good. They tend to have specific meditation or guided imagery for sleep as well. And again, the free yoga classes through YogaX and the Osher Center at UCSF. And then this palousmindfulness.com has an eight-week free course in mindfulness education. I also do want to mention there's another resource that I found out about this week, so it's not on the slides, but it's cancersupport.net is a Bay Area support system. It's based out of the East Bay, so if to take any, actual in-person courses, everything is in the East Bay, but they do have a lot of online classes for education, as well as kind of yoga and exercise and things like that. So that's all based through their website. So again, that was cancersupport.net. And these are some of the references that I used. And that's it. Thank you.